I'm shocked that no other provider caught this when she had a rash and she just started Lamictal. That should have warning signs in your head. And then further getting admitted and your patient feels like crap, they're disoriented, they're confused, they have a rash, and they just started a new medication. Like, I don't know what happens across the ERs, but we need to be checking med lists. And I know that it's hard to do when patients are disoriented and they don't have the staff to follow up with pharmacies, but this is again why it's important to have an emergency medicine pharmacist in the ED, because they would have caught that. Anytime a patient comes to me and even asks a question about over-the-counter items or their symptoms they're having, my first question is, what is your med list? What medications are you taking? I'll usually find issues with their med lists that don't even pertain to like what they're coming to me for, namely like improper doses or duplicate therapy. But this is again another PSA, like ask your pharmacist when you start a new med, is there anything important about this medication? The healthcare system is very fragmented right now. Because of corporate greed and capitalism, pharmacies are not adequately staffed. They'll throw one pharmacist in a store and have them fill 1,000 prescriptions a day. Always, always, always check your pills, check your labels. Always, always, always talk to your pharmacist if you have questions on your medication. There was no way for this pharmacist to know that this was a new start medication for this patient. There is extremely poor communication between providers and community pharmacists. It's another thing I try to talk about on my page. Put a diagnosis code on your prescriptions. Talk to your patients about the medications you're prescribing in the office. If you don't have time to do a full counsel, let them know the biggest or most important thing about that medication and maybe a couple side effects to watch out for. Put a direct phone number for your office or your provider and the prescriptions. If you're not sure if something's in stock, call the pharmacy beforehand. If you're not sure how to dose a medication, talk to a pharmacist before you send it in. If you're not sure something is covered with the insurance, call the insurance. Run a formulary check. Medicaid formularies are all online. Or call the pharmacist in the pharmacy. We'll run a formulary check for you. Put notes on the prescriptions. Counseled patient on drug interaction. Discontinuing naproxen. Initiating diclofenac. There are a lot of things that providers can do to prevent mistakes like this.